And good morning, Doctor. How are you?
Good morning, I'm great.
Happy Halloween.
Yes.
you
We
bring out some
survived.
candy?
I didn't have any candy.
Yeah, that's right. That's right. We talked last week.
I went to a
about,
party.
That's it. We talked about last week about maybe alternative kind of treats and things like that, but it also is a good introduction into this month, right?
Yes, because Halloween precedes Diabetes Awareness Month, and there's probably a reason for that. Because if you've eaten a lot of candy and you don't feel good, then you might have diabetes.
Yeah.
If you start being thirsty, going to the bathroom a lot, having blurred vision. So November is Diabetes Awareness Month, and we were just talking about the colors of the ribbons for Diabetes Awareness Month, and I still think dark chocolate brown would be the best color.
Yeah, that's right.
Or white for sugar, but I think it's gray.
In any case, it is Diabetes Awareness Month, and so let's talk about some of the facts and figures. How many people are we talking about?
Well, we're talking about lots and lots of people, and as the population gets older and fatter, there's going to be more and more people with diabetes. The estimate is 30% of the population in the U.S. by 2050, but I think it's going to be sooner than that, because actually people over 65 now, a third of them have diabetes.
Really, a third?
And then looking at the whole population, it's 10% of the population of the United States, so it's 30 million people, and another 86 million have pre-diabetes. So that's a lot of people have some form of diabetes, or they're going to get, or they have a potential to get diabetes. So it's a very big problem in this country.
Okay, well let's talk about what it actually is then, just to back up and give everybody an overview.
Diabetes is just a disease in which your blood sugar is too high. That's it. I mean, there's lots of reasons for that. There's probably 300 different genetic reasons for it. There's type 1 and type 2. Type 1 is when you make no insulin. You have antibodies attacking the cells that make insulin, the islet cells in the pancreas, and they kill them off. So you don't make any insulin, and you have to take insulin shots to live. If you don't have insulin, you die. So that's the more severe form. That's what people, call bad diabetes or brittle diabetes is type 1. And that's harder, a little bit harder to control, since our insulin is not as perfect as your own body's insulin.
Really requires vigilance.
Yes, and constant monitoring, pretty much. The type 2 diabetes is more genetically oriented. So 90% of the people have had family members with diabetes. If you have one parent with diabetes, you have 50% chance of getting diabetes. Two parents, 90% chance. So it's mostly a genetic disease of insulin resistance or defects in regulation of the insulin production. So you either make too much insulin for a long time to try to keep your sugar normal, then your pancreas wears out, or you don't make insulin at the right time and have to make too much at the wrong time, which wears out the pancreas also. So eventually, even type 2s may need to be on insulin because their pancreas wears out, and that's just the natural history of type 2. Most people that we're talking about have type 2. 90% of people with diabetes have type 2, although type 1 appears to be increasing. They're not really sure about that, but it's still less people have type 1.
Now, you say that that a third of people over 65 have diabetes. Is some of that just age related? I mean, is it just possible your pancreas just wears out after 65?
Yeah, it wears out, but there's a reason it wears out. Some people never get diabetes. It's not true that just because you age you get diabetes. There's some kind of genetic defect that causes you to eventually wear out your pancreas. But the older you live, the more likely you are to have diabetes, just because the pancreas does get old also. So if it's having to struggle through your whole life to make enough insulin, then it's going to wear out sooner. So the idea is not to let it wear out, is to treat the diabetes early, very early. I think that's why Diabetes Awareness Month is important. If you have a family history, then you need to get checked.
Now, how much of this, though, especially for type 2 diabetes, is because of bad choices, bad habits?
Well, do the bad habits come first, or the body makes you have bad habits? So that's always a question. Which comes first, the obesity or the insulin resistance? And I would say it's a genetic disease, so there's some genetic component, and that is insulin resistance. Insulin resistance makes you hungry, makes you crave carbohydrates, makes you crave starches and sugars. I'm not saying that part of it's not your fault, but most of it is pre-programmed. So the reason you like potatoes may be because you're genetically prone to make more insulin, and insulin makes you crave carbohydrates.
Maybe the correct response is you're not helping things. That'd be better. It's not your fault, but you're not helping.
If you know you're going to get a genetic disease, you
Yes.
probably need to like work on it so that you don't get it. That you need to not just give up and just say, well, it's inevitable. It's not inevitable, especially with the medications now that actually probably prevent you from getting diabetes because it corrects the genetic defects. So a lot of times if we get people early and their blood sugar is not that bad, we can probably prevent them from getting worse diabetes later.
Is diabetes life shortening?
Probably, but now it's a lot better than it was. In the past, it was very much life shortening. I think now what happens is people get heart attacks and heart disease, and that's life shortening. But as far as diabetes itself, it's not.
But a lot of if you develop the good habits, all like that, you can maybe ward off some of those other things too.
Yes,
right?
and I think the good habits, I think any genetic problem, look at your parents and grandparents and see what's wrong with them. If they have a lot of diabetes in the family or heart disease early, and people get heart disease early without getting diabetes because they have insulin resistance, and they'll die of a heart attack when they're 40 or 50, and then they don't have time to get diabetes. You have to live long enough to get diabetes. So just because you don't have diabetes in your family, look at your family as far as heart disease, who dies young, why do they die, that type of thing.
Okay. All right. As we continue on, we want to talk a little bit more about the risk factors and how you know you're at risk, and also what you can do to decrease that as well as we continue on with Sugar Talk with Dr. K.G. Lucas. Hey, welcome back to the program here on Coastal Daybreak on the Talk Station, FM 107 at AM 1240. Sugar Talk with Dr. K.G. Lucas from Diabetes and Endocrinology brings you this program every Monday morning, and we're talking about Diabetes Awareness Month. So, Doctor, let's talk a little bit about some of the risk factors here too. What should they know about being at risk?
So diabetes is not just sugar floating around in your blood. Sugar sticks to everything. Just like if you poured syrup on your body, it sticks to everything. That's the way your blood is when you have diabetes and your blood sugar is high.
So you're not taking syrup intravenously, right?
Yes, intravenous syrup. It sticks to all the cells and all the blood vessels, the small blood vessels, the large blood vessels. It causes lots of problems. So it doubles the risk of heart attacks and strokes just from normal risk. And it's the leading cause of kidney disease, kidney failure, and it's the leading cause of blindness in adults is diabetes. And it's because the kidneys and the eyes have very small blood vessels, and they get clogged up first. And they can bleed, the eyes can bleed and make you blind, and then the kidneys can start leaking out protein and get damaged so they don't filter everything right, and you end up on dialysis. So the reasons for treating diabetes are the long-term complications, but also short-term is if your sugar's high, you don't feel good. You're thirsty a lot, you're urinating a lot, you may be getting up multiple times at night to go to the bathroom, and that interrupts your sleep.
And then if your sugar crashes,
then if you have low sugars, you'll feel shaky and starving and going to kill somebody to get some food. So that type of thing, pay attention to. Or if certain foods make you sleepy, and it's not just turkey, it's if starches make you sleepy. Everybody thinks they're sleepy after Thanksgiving because of turkey, and that's not true. It's usually because of
the mashed potatoes are great.
the dressing, the mashed potatoes, the sweet potato pie, or the pumpkin pie, and
or you're
things.
annoyed with your great aunt.
Or you're sitting around watching football, or you're not doing
That's
anything.
When you get sleepy. All right, so let's talk a bit about also you mentioned these things, but another one of the things that we do see with diabetics that have it chronically and not controlled is they have extremity issues, pain.
They can have tingling and burning. The sugar sticks to the nerve endings also.
We probably all know people who've actually had amputation.
Yeah, the nerve endings and blood vessels, if they get damaged, then you won't feel anything when you injure your foot. You can get blisters on your feet without knowing it. People go around with nails in their feet sometimes, go through their shoe and they don't know it because they don't have any sensation of it. And so it creates infections. The infections don't heal up as fast. And if you get gangrene, which is a severe infection of your foot, then you may have to have an amputation. A lot of things can be done before that. Mainly just look at your feet every day. If you have diabetes, you want to look at your feet to prevent any kind of thing. If you wear new shoes, you don't want to wear them very long at a time. You want to check it for any kind of redness or anything afterwards to make sure it's not going to rub a blister in.
If you want to keep up with diabetes and the research involved in diabetes too, go online to beachdoctor.com for diabetes and endocrinology consultants. Again, that's